Hello, and welcome to Syngenta Innovation's latest webinar, Innovative Breakthroughs in Women's Health Technology. I'm Kate Marcio, Director of Women's Health for Syngenta Innovation, and I'll be your host today. So before we begin, I just want to go over a few items so you know how to participate in today's event. You'll have the opportunity to submit questions by typing your questions into the questions pane of the control panel. You may send your questions in at any time during the presentation. Please also use the question pane if you have any technical issues, and we'll be sure to do our best to resolve them. I'm now delighted to introduce you to our presenter today, Erica Cantor. Erica is Head of Women's Health for Syngenta Innovation. She supports companies in the medical industry achieve commercial success and improve patient outcomes through the development of breakthrough products and services. She's particularly passionate about holistic, human-centric design and women's health innovation. Welcome, Erica. The floor is yours.
Thank you, Kate. As Kate said, my name is Erica Cantor. I'm Head of Women's Health at Syngenta Innovation. Today's webinar is on the topic of innovative breakthroughs in women's health technology. Our agenda includes the current state of play in women's health, so looking back at the past year and the reasons that we feel hopeful about the future of the industry, the innovation hotspots in 2024 and beyond, so the disruptive areas in women's health, and we'll close with how empathy drives commercial success and how critical it is in product development for competitive advantage. Finally, we'll have a Q&A at the end. As Kate said, please feel free to submit your questions as we go, and we'll answer them at the end of our presentation. Let's start with the current state of play. Before we dive in, I think it's important to define women's health and wellness. For the purposes of this presentation, we define women's health as the preservation of wellness and prevention of illness in women, focusing broadly on conditions that are unique to women, biologically different in women, or more common in women. Often women's health gets constrained to reproductive health, but for this presentation, we would like to cover the breadth, as that is critical to the future of the industry. When we talk about women-specific conditions, that includes endometriosis, menopause, pregnancy complications, looking at conditions that affect women differently. This is where there's a biological difference in how they present, atrial fibrillation being one example. And finally, conditions that affect women disproportionately or are more prevalent in women include asthma and arthritis, and so have a higher effect on women than men. For the purposes of this presentation, it's also important to note that when we say women, we're using that interchangeably with the term female or people who have been assigned female at birth. But we will say women for the sake of this presentation. Interestingly, when you look at the health burden on women, and this is looking at it in disability-adjusted life years, women-specific conditions only make up 5% of that burden. And this is from a recent World Economic Forum Insight report, and it looked at the global effect of all of these conditions on women. Now, what's important to note here is that although this looks like a small percentage, it's likely an underestimate due to the historic data gap in women's health. What's exciting here, actually, and I choose to see challenges as opportunities, what's exciting is that there's 95% of the burden that is from conditions that affect women differently, disproportionately, or are similar to conditions in men. So there's a massive opportunity to reduce the women's health burden through holistic approaches to women's health. In fact, according to this report, addressing these gaps could boost the global economy by $1 trillion annually by 2024. And that's the only reason you need to have to invest in women's health. The economic benefits are clear. There's a huge opportunity. What we need to do is change our definition and change our focus beyond reproductive health to ensure we're addressing the full care continuum and lifespan for women. Looking at the investment landscape, despite a challenging fundraising environment over the last couple of years, which has been experienced across industries, women's health startups in the US saw gains both in their average deal sizes which have increased year on year since 2020, as well as the percentage of healthcare VC funding that they raised. Now, those numbers still look small, and they're the ones in red at the bottom there, which you can barely see on the graph. But the positive thing from this message is that despite headwinds, despite fundraising challenges, women's health has seen growth and now has 4.3% of total healthcare VC funding in the US. That's a very critical change and shift in the industry. And the average deal size increasing also tells us that investors are putting more value on women's health startups. There are still challenges, and women's health startups still face roadblocks. We see this in our conversations, both with VC funds and with startups on a day-to-day basis. Women's health startups often have trouble convincing investors that there's a need, usually because it's challenging to accurately estimate market size. It's difficult to receive FDA approval and get reimbursement, mostly because of that lack of data on women's health conditions, and that comes from the historic lack of representation in clinical trials. That has left us with a lack of understanding, and without that basis, it's difficult to prove future success and make those accurate projections. While that's starting to change, and the FDA is pushing for that change, research is still lacking sex-based analysis. So while they might include the correct proportion of men and women in their studies, they're not necessarily disaggregating that data by sex. And that is an important step, again, to understanding, particularly for those chronic conditions that affect both men and women, what the differences are and how tailored solutions could be produced for all the population. All right, on to our reasons to feel hopeful. So in the last year, we saw a number of exciting launches and approvals in the women's health space from big players, including Roche Diagnostics, who received CE mark approval for a new PCOS diagnostic method, and Thermo Fisher, who received FDA approval for the first ever blood test to predict preeclampsia. Very exciting spaces to see growth in and expansion of existing portfolios for both Roche and Thermo Fisher. A couple of startups as well had exciting launches. Sonio received clearance for an AI-powered prenatal ultrasound software, and the aim of which was to improve efficiency for practitioners. And Aspivix received a CE mark approval for their IUD device, which was aimed at lowering procedural pain. So all of these are addressing key unmet needs in the women's health space, and it's great to see that activity. You will notice that these are still focused on women-specific conditions. Looking at acquisitions, despite headwinds and despite a reduction in M&A activity across the board in medtech, we still saw some very exciting movement in women's health. Atlantic Therapeutics was acquired by Caldera Medical. So Caldera Medical was historically a surgical-based company for pelvic health, and they've expanded into a completely non-invasive solution with Atlantic Therapeutics, which is very exciting. Maven has acquired Natal, so expanding their portfolio, and that's exciting to see because Maven started as a startup, a unicorn in women's health, and is now making their own acquisitions. Pharmavite works in nutritional therapies, and acquired Bonafide recently to expand their portfolio into menopause care. And menopause is a growing space and one that's receiving more and more attention, both from innovations, but also policy changes for the workplace and for insurance. Finally, we've seen a few initiatives around the globe, which are also giving us reasons to feel hopeful about the momentum building in women's health. The UK renewed their women's health strategy with updated priorities for 2024, including menopause, menstrual problems, and maternity disparities. The World Economic Forum launched the Global Alliance for Women's Health and pledged $55 million to reshape the future of women's health. And excitingly, the US announced the first ever White House initiative on women's health research. Recently, I believe it was a week or two ago, they announced $100 million in federal funding to fuel research. So alongside corporate activity, we're seeing policymakers and governments working together to push this space forward. So where should we focus next? As momentum builds, funding builds, what are the future hotspots, the areas for disruption where we'll start to see more and more activity as this space grows? We believe there's 3 areas. The first is the shift from consumer to medical. Women's health startups that we've spoken with have often chosen to stay within the consumer space. It was a lower barrier to entry for them when looking at market launch. Getting FDA approval is challenging and requires a much more stringent development pathway. And so often they sought a direct-to-consumer route first. We're seeing more of those startups now looking to expand into the medical space and provide that fully integrated, patient-centric, clinically validated solution for women. But it's an interesting decision to make. So when companies talk to us in the early days of their development, they're at this crossroads, and it's important for them to define their business case, their value proposition up front, and make those decisions around the regulatory pathway before starting their development, because it has impacts on where they focus their time and efforts. So there are typically 2 routes. One is to stay as a consumer product, and one is to seek a regulatory approval. For a consumer launch, you have a faster time to market, and you also have the benefit of direct user engagement. So you're selling direct to your end users, your patients, women specifically, and you can get that direct feedback and have that engagement with them. But it does limit the claims that you can make. You can't make medical claims without having done clinical trials and gone through approvals. You also don't have the benefit of reimbursement, and so the cost for those products comes directly from your users typically, which means you're having to enter at a lower price point. If you were to go for a medical product launch, you have the benefit of trust building with stakeholders, not just patients, but healthcare practitioners, family members, other stakeholders, through the building of medical claims that you can use for your promotion. You also have a potential for higher return on investment. The investment being the investment in the development process itself, but being able to market at a higher cost to the clinical stakeholders. It is a more complex sales channel with the need for reimbursement codes and the like in the States in particular, but there are potential benefits to going that route. What we're seeing is companies that start down the consumer route, launch with a direct-to-consumer product, gain the traction, the data more specifically required to then conduct their clinical trials and transition into the medical space. Pros and cons to this route. Yes, you have that faster initial market launch and lower barriers to gathering that initial user data, but you have a potential time and cost effect of having to backfill your design history file for a medical product approval and launch. It's a non-trivial challenge. It's a complex process to develop a medical product, and it requires rigor and quality management systems, and it shouldn't be taken lightly. But it is a potential route, and one that we've seen successfully done recently by a company called Bloom Life. So Bloom Life recently received FDA clearance for its maternal fetal monitor Pro device, which is a prescription-based wearable designed to monitor maternal and fetal heart rates. But Bloom Life started and launched back in 2014 and started as a direct-to-consumer offering for women. And it was very specifically a consumer product purely for detecting contractions and displaying statistics in an app. Their plan all along, though, was to launch a medical product and provide that additional care and service within the healthcare system. And they got that clearance recently in 2024, and just in the last couple of months. And they're offering now, Bloom Life Connects provides a single comprehensive connected care platform, which includes this cleared device for at-home monitoring. Now, the blue dotted line shows a straight line from one to the other. I'm sure they had their challenges and hurdles along the way. It's not a straightforward process, but fantastic to see this as a case study, and hopefully one that other women's health startups start to mimic as they mature and provide more offerings to the healthcare system, but more importantly to patients. As discussed, female specific conditions have been the focus, and fertility, I think, has gained something like 60 or 70% of the investment that goes into women's health startups. But that's starting to change, and there's a huge opportunity beyond reproductive health. And this will drive both investment, but also research into these non-reproduction focus areas. This is a huge, huge opportunity. Just as one example, if we look at the challenges faced by women over 40, so when we start to talk about healthy aging for women, here is a subset of the challenges they may face. Now, some of these are specific to women, some women experience differently or disproportionately, and some are general conditions that are experienced both by men and women, but it shows you the scope of the challenge that can be addressed. And so companies, big and small, that already play in these spaces and have one-size-fits-all products and solutions, they have an opportunity to expand their portfolios and offer tailored solutions, personalized solutions for men and women by conducting the right research, the right clinical trials to understand what those differences are and ensure the needs are truly met. One interesting case study for this is Qven. So obtaining regular blood samples of sufficient volume is often a barrier to at-home testing. But excitingly, the collection and analysis of menstrual blood offers a unique and powerful solution. Qven is the first example of this with FDA clearance. So Qven received their clearance recently, just in the last couple of months, and they made history as the first ever FDA cleared menstrual blood health test. Menstrual blood has not been used prolifically or hardly at all. There are very limited clinical studies on menstrual blood, and yet it's a completely non-invasive biopsy that people who menstruate produce every cycle. Why aren't we harnessing the power of this data? And Qven is looking to open the doors to that market. And I think with the opening of that door, we will see, hopefully, the emergence of a whole new range of solutions for women's health. Interestingly, Qven's first launch is actually for monitoring prediabetes and diabetes. They are also looking at the future diagnostic potential for menstrual blood, of course, and looking to validate other biomarkers, including those for anemia, perimenopause, endometriosis, as you would expect. And so having something at home like this opens huge possibilities. What's very exciting, actually, is that not just the diagnostic potential of menstrual blood, but beyond diagnostics, studies are starting to be conducted on stem cell research. And so typically stem cell research has used stem cells from embryos or bone marrow more often for adult stem cells. It turns out the endometrium also produces stem cells, of course, because it's part of the body that renews on a regular cycle. And it sheds these stem cells in menstrual blood. And so if these stem cells could be collected, it holds huge potential for therapeutics. And in the right conditions, they can be differentiated into cell types, including fat, bone, heart, liver, and skin cells. So there's massive, massive potential in this space. And I think with Qven's launch, we'll start to see growth here. And the third space where we see there being an innovation hotspot moving into the future is in enhancing the continuum of care. So particularly for big players who already have products on the market, are already addressing women's health needs in specific areas. The conversations that we're having with these types of companies are that they are looking for opportunities to expand their portfolios into adjacent spaces. And these adjacencies may be across the care continuum for specific conditions, or they may be across women's lifespans to address health holistically for women. Now, when we look at the care continuum, We talk about prevention, screening, diagnosis, treatment, and monitoring as the sort of classic segments. Prevention is where everything is shifting towards. So we see a lot of companies looking to actually reduce healthcare burden through moving into that space, but also moving towards minimally invasive point of care, from the OR to the clinic, from the clinic to the home. These are all trends that are looking to improve that care continuum for specific conditions. Across the lifespan, women experience all sorts of things, general health conditions, mental health, fertility, sexual health and wellness, various oncology conditions, menopause. And so it will be interesting to see if medical companies start to pick up the classic consumer model of wanting to be part of a woman or their customers through a lifespan. If you can become sticky with a patient in the early days and address their concerns through life, you have the potential to improve their health holistically and keep them as a customer. So there's lots and lots of potential here for big players and small. One example is Hologic. So Hologic is a massive women's health company, and they're also the only company that provide technology solutions across the full breast care journey. So Hologic's mission is to transform the intricate breast health journey into a seamless experience for women and their providers. And they have done that both through organic growth and inorganic growth. So they've made a number of strategic acquisitions alongside their development activities to address the full continuum of care from start to finish for breast health, which is very exciting. So when you're starting to think about that next development, that next innovation, whether you're a women's health startup or a big company, whether you already play in women's health or are new to the space, how do you ensure commercial success? Well, one of the ways to fully implement change is to apply deep empathy to the design of women's health solutions. And this is a practice that we employ at Studentia Innovation and one that we advocate for our clients as well. Bringing empathy to design has to be an intentional act, and it's a vulnerable choice, and one that can't be a tick box exercise. It needs to be embedded in your process. Empathy has the potential to foster genuine connection with another person, and it's only through that connection that we truly understand their unmet needs. We need to put ourselves in their shoes, understand their journey in order to see where solutions may provide the most benefit, the most difference to their lives. This is an example of a classic design thinking process, which does include empathy at the start, and that's where we uncover unmet needs before defining problems, ideating around those problems, developing solutions and prototypes, and testing those prototypes. But that's not enough. Empathy has to be integrated at every stage in this process. So yes, you use empathy to uncover unmet needs, but you also need to ensure you have diverse teams developing those solutions. Otherwise, those needs will get lost in translation. You need to start and spark new ideas through co-creation with actual users, actually getting face-to-face through ethnographic studies and understanding where the challenges are, and then validating those unmet needs through iterative, consistent user testing. And it's not only at this stage in the development process that empathy is critical. After this, you move into regulated product development, and suddenly other factors start to seem more important. And yes, these are all critical criteria to balance when you're developing a new product: the manufacturability, the cost, the regulatory pathway, sustainability. These are all considerations, but they need to be taken in balance with usability. And empathy is how you do that. So that iterative user testing isn't just in the first part of this process, it's throughout the program. And there are 3 key actions that you can take to embed empathy in your design process. And these are approaches that we take here at Studentia Innovation. The first is to diversify your team. And when we talk about diversity, it's not just having a table full of women designing a women's health product. It's diversity of thought. It's different backgrounds, different experiences to ensure you're really driving innovation to the edge. Assign an empathy champion. So this is a great way of ensuring that the voice of the user is represented at every stage of development. And so this is a team member that would advocate for your user and be that voice throughout. And finally, beginning with a beginner's mindset. And this is something we can all bring to every aspect of our lives, but particularly for new product development. So it's around checking your biases and assumptions, and really bring that curiosity to the process, not being scared to say, I don't actually know. Let's ask the question and seeing where that takes you. So those are the three tools, three main steps that we take to ensure that we're driving competitive advantage through deep empathy in our development process. Some final thoughts to close out and leave you with before we move on to questions and hopefully some answers. The three key takeaways, I think, from this talk are that, one, successful scaling of new innovations really requires collaboration. And if there's any industry where we see great collaboration, not just between stakeholders, but also between competitors in some cases. But importantly, change will be driven from policymakers, healthcare providers, advocacy groups, innovators, and women at the core. Both startups and big players have the power to enact change. So this has been an industry where we've seen a real bottom-up push for change. It hasn't been driven by policy, it's been driven by women who have said enough is enough, something needs to change here, and they've become the founders of the startup companies that are pushing the industry forward. And so successful companies will recognize this change, will recognize the momentum that's building, and bring empathy to the forefront, not be afraid to embrace this change and be agile to the opportunities for innovation. And finally, a practical approach is required to ensure that solutions are commercially viable, as well as addressing the diverse needs of women globally. And so this is where you balance your human-centered design approach with a solid market analysis and a really technically feasible solution to ensure that innovation will be successful and that your market launch will be successful as well. So there's a whole talk we could give on how to build a value proposition, but I'll leave that for another day. Finally, if you're curious to know more about topics that we've covered in women's health, we have a number of white papers that are available from our website. The QR codes are here as well. If you want to give this a quick scan, we have a number of exciting white papers on specific topics and broader topics as well. We've also done a few other webinars in the past, and these are all on our YouTube page, including topics of female nutrition, IVF, and breast cancer screening. So feel free to go and check these out as well. Thank you very much for joining us. That's all we have for today, and we would love to take your questions.
All right, thank you, Erica. Appreciate all your insights, and always nice to hear what's new. We're going to go ahead and begin the Q&A session. Please note that you can still submit questions through the question pane on your attendee control panel. So we'll go to our first question. So for established women's health markets like breast cancer screening, how do you change the status quo?
That's a really interesting one. Breast cancer screening is a space that we have looked at internally as an initiative, and it has been very heavily dominated by mammography, of course. Mammography is the standard of care in breast cancer screening, and there's a long history of data to prove that it does work in reducing the burden of breast cancer and identifying breast cancers early. But it's not ideal. It still holds a lot of challenges, both for patients, for women who have to get screenings. It's not as accurate for dense breasts, for example. And there are players that are coming out with solutions, but I think they're finding it challenging to get a foothold because of this, the sort of established players in the market. I know this is a space you've looked at as well, Kate. What are your thoughts?
Yeah, I think in the medical industry in particular, it's hard to change things that have been done a certain way for a long time with healthcare practitioners. I think when you look at changing something that's been done a certain way for many years, there's many things you have to consider, and the larger players are really set up well to do that, to make those changes, but are often very heavily invested in the way things have been done. So I think it's a combination of the innovators, the startups, and the large strategics to take those risks and to be willing to look at the, what's really the core needs of women, really have an eye to the future instead of focusing on the short-term profits, and be willing to sacrifice some of the current model to see the vision for the future. So sometimes the technology is the easy part. We have a lot of technologies, especially in breast cancer screening, that are safer and do provide better results for women, especially with dense breast tissue. So I think when we look at those technologies and why they're not more widespread, I think it goes back to looking at an industry like medical that's highly regulated and slow to change. What are the opportunities to change that? And I do think it has to come from not only women demanding that from kind of a bottom-up perspective, but also from these companies that hold the power and can really that have the channels and have the relationships and can really advocate for these safer, better technologies to be offered to women more widely.
Mm-hmm, mm-hmm. Definitely. Thanks, Kate.
Let's go to our next question. So this is interesting, and I've heard this question before. I'm curious your thoughts. Do you think more women need to be involved in the actual designing of women's health solutions?
Yes and no. As you said, I think this is something we've talked about before, and a question that plays on everyone's mind when you start to talk about women's health technology. Yes, it takes empathy, and women are more likely to empathize with the challenges faced by women and design technology appropriately. But does it need to be an all-female team? Do we need more women around the table? Yes, but I think, as I talked about before, actually the critical thing is diversity of thought. So, for example, if we were designing, a surgical robot for cataracts, as a random example, I don't need to have had cataracts to empathize with the challenges with cataracts. Just like I don't need to have a uterus to empathize with the challenges that people with uteruses may face. And so I think it's more important to have diverse people around the table. I can imagine if we had a full table of white females who graduated from Cambridge, they'd come out with something that was less innovative than a table of diverse thinkers with diverse backgrounds and experiences who could push the boundaries of innovation. So it's a balance. What do you think?
Yeah, I agree. I think when it comes to involving women, the woman doesn't necessarily have to be the designer. I think you see a lot of legacy products that have been used in women's health that were kind of designed by men and perhaps didn't consider women. And I think that's really where we see the shortfall in some of it, was perhaps women weren't considered. I think designers in general tend to design for themselves. They can. I think that it's become a lot more aware of, user-centered design and really empathizing with the user, really understanding those core needs. It's amazing how much you see that step is either accelerated or skipped altogether and not valued as much in the design and development process. But I think anytime that you're taking the time, and I think you really need to take the time to do that. So whether it's a woman designer or just involving women in the design process, I think that's important. I do think diverse design teams can often come up with better solutions in some cases. But yes, I don't believe you need to be a woman to design better products.
Agreed.
All right, we have another question here. So what would be the most important thing women's health needs right now? Is it funding? Is it more policies, regulatory support, education? Is there anything that stands out to you that we need the most right now?
Oh gosh, that's a tricky one. All of the above is probably the answer, but I think it still has to be the funding side. I mean, we're seeing government initiatives, we're seeing policymakers wanting to make change, but the money has to lead, and so without the funding, the innovation can't follow. I think it has to start with the funding, but it's a chicken and egg because education is actually what's required to get that funding in a lot of cases. Women's health has been an interesting industry for that. A lot of the successful startups that we've seen have not just launched products, they've launched full education and advocacy campaigns in order to be successful, because they have needed to educate an entire industry on the unmet needs in the space and why their product's important and necessary as a change. And so it may be a balance there, it may be a sort of a combination, but I think that the education will drive change in the industry, and the funding will be required. We're still getting less than 5% of all health tech VC funding in the States, and that's not enough to do what we need to do to make the change here. So it's all of it. What do you think?
Yeah, I think funding for sure always helps fuel an industry. Just because it's a women's health product doesn't mean that it's going to be successful. I think so. Investors still need to be diligent and really understanding, what the right opportunities are. But I think that a lot of that does come back to education, not only of just kind of creating more awareness, education around, really understanding the opportunities here, because there's massive opportunities for investors in this space. And I think we're seeing a lot more of that come to fruition, like you were explaining. But I think education also in the healthcare system, I think there is a status quo and ways that things have been done for a long time. And even in the way healthcare is taught in medical school, a lot of it's based on male anatomy, on male animal studies, on that data. So as we start to see that shift and really from the ground up start educating our medical providers on the differences between male and female health, like you were saying, there's a lot of indications that just affect women differently, but aren't specific to just women. And it needs to start there. I think I can't say that I know if that's changing or not, but I do think that's an area that does need to significantly change. And also educating women on their choices and their options and the ability to take health into their own hands. And I think a lot of things you're talking about with at-home diagnostics, using menstrual blood to understand your overall health, not just women specific things, but other general health and wellness. I think as we start to see more of that for both men and women, but in women's health specifically, as we start to educate women more on their bodies, their ability to get support for these things, kind of breaking through the taboo of some of that, because it's not just taboo for maybe men to discuss it. I think women are also uncomfortable to sometimes ask certain questions or bring certain topics up to their providers. So all the awareness and education we're putting out there, and a lot of the work so many women are doing and men to really promote women's health and create a better solution. I think all of that combined is going to just raise raise a lot of the overall support for women's health in general.
Definitely. No, I couldn't have said it better. Thank you, Kate. I think that's probably all the time we have, unless there's any other questions.
We do have a few more questions, but I think that's all the time we have. If we didn't get a chance to answer your question, Eric and I will be sure to reach out and follow up with you directly. Please note, if you'd like to watch this presentation again or share the webinar with your colleagues, we'll be sending you a link, and you can also find it on our website, sagentiainnovation.com. We'll have it posted in a couple days. If you'd like more information about any of the topics we discussed today, please be in touch with us at info@sagentiainnovation.com. Once you leave today's webinar, you'll receive a survey, and we'd appreciate if you complete it and provide us with your feedback. It always helps us to continue to improve and provide meaningful content in the future. For any additional information or to learn more about Sagentia Innovation, please follow us on LinkedIn. And on behalf of Sagentia Innovation and our presenter, Erica Cantor, thank you again for joining us today, and we hope you have a great rest of your day. Thank you.